Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 23 weeks pregnant, so moving right along here with the pregnancy. This week I thought we'd talk about something that I commonly will see women for during their pregnancy, which is carpal tunnel syndrome. So when you're pregnant, there's more fluid retention going on. Most women can relate to that, and some have it a little worse than others. But that fluid retention can put some pressure on the nerve and create that numbness, tingling into the hands. And sometimes women just get it when they sleep. Sometimes it's an all-day thing, and sometimes it's more work-related. So there are a couple things that we can do. But again, if you're having a lot of fluid retention, we would want to make sure that we're monitoring blood pressure, that your OB is aware. So again, there's no signs or other symptoms of a condition called preeclampsia, which is life-threatening to mom and baby. Again, but fluid retention is very common in pregnancy. So if everything else checks out, there are a couple things that we can do. The first being, I'll do a combination of an active release technique to kind of help stretch the muscles out, as well as kind of helping with fluid drainage as well, to kind of get that out of the area to take pressure off the nerve. And then we can also adjust the wrist as well to, again, relieve that pressure off the nerve. If it's only happening at night, sometimes using special splints will help position the wrist in a way that you won't have symptoms and hopefully won't be waking up with symptoms, because I know sleep in pregnancy can be challenging in general, let alone if you're also having carpal tunnel that's waking you up. The other thing is acupuncture, and acupuncture works really well, again, to help with symptoms, reducing the pressure off the nerve so you're not getting that numbness and tingling. And then the third thing is a kinesio tape. So kinesio tape is a special tape, and depending on how you tape the area, what therapeutic benefit we're looking for, it can have multiple different effects. So this one would be more for help for fluid drainage, again, to take that pressure off the nerve. And it does come in different fun colors, not just the blue. And we would tape that, and again, I usually send women home with that, and that tape can last anywhere from 3 days to a week, and again, provide a lot of relief. And again, sometimes with carpal tunnel, it tends to be some more of a chronic issue until you give birth to baby, and again, it just has to do with fluid retention, but symptom management can go a long way here, and sometimes women can get relief for a couple days at a time without having any symptoms. So again, there's multiple things we could do to help treat with carpal tunnel, and just making sure that there's nothing else going on that would affect mom and baby.